morning. Welcome to the Summit Women's Network Talk Show. How's everybody this morning? Great. Glad to see you guys. You know, today we have two great speakers. I'm sure everybody has read the brochures, right? You know that we have physical therapists here. And everybody who's here on a regular basis knows that I don't usually read from anything. I try to do everything from my head because I'm familiar. Well, and I am familiar with the guests today. We've got FARRAH Smith, who is my personal physical therapist, awesome woman. She had her MPT, that's the Master of Physical Therapy, in 2002 at Texas Tech in Lubbock, Texas. We've also got VIAJAY, and I always remember his last name, PARIKH. VIAJAY is the owner of Greenhouse Physical Therapy. He also has a master's in physical therapy, and he got that at Cambridge University in California. Cambridge University? Chapman University in California.
Cambridge sounds better.
Cambridge sounds better, right? And he is the owner of Greenhouse Physical Therapy. They have 9 locations throughout the DFW. He has been an owner since 2002. They opened their first location in 2000. So if you all guys would join me in welcoming FARRAH and VIAJAY.
And I gotta say, that's pretty impressive that you memorized all of that. Good.
Well, you know what, I'm really not that great at that, but you know, I kind of know you guys. So
Yeah, no.
I like to get familiar with
That was
people
really good.
like you, right? We're gonna have a seat, guys.
Okay.
We're gonna, what we're gonna do today is, everybody, especially you guys know that most of the ladies here are 50 plus, and we all have our own ailments. So I'm just gonna kind of get a little bit of background, ask you a few questions about physical therapy, and allow you guys to just say some things on your own, and then we're gonna take some questions from the audience. How's that sound?
Awesome.
That's great.
Great, okay. Well, the first thing I'd like to know, and I did write my questions down, by the way, something I don't usually do either, is how important is physical therapy to someone after they've had surgery or
Talk into your microphone.
Yeah, talk into your microphone, you take away from it.
Talk into it.
how important is physical therapy to a patient's recovery?
Okay. So if you've had surgery, or even if you haven't had surgery, but you have an injury or some kind of, musculoskeletal ache or pain or something like that, physical therapy is the only specialty available that specializes in treating those kind of problems. So if you have surgery, you go to a surgeon and he operates on you and then he's done. If you have a non-surgical problem, you go to your doctor, he gives you some medications and he's done. He or she's done. So those are those people's specialties. And then where you go to learn what to do and have things done to you or for you to help you recover, whether it's your knee, shoulder, ankle, wrist, neck, back, or whatever, that's where physical therapy comes in, and that's the specialty of physical therapy, is helping you get back whatever body part, loss of range of motion, strength, or whatever, pain in the muscle that you're dealing with. So it's a hugely important thing. A lot of people don't know what physical therapy is. When I first started practicing, which was about 19 years ago, I think I tell people I'm a physical therapist. They say, "Oh, okay, you massage people all day." It's like, well, no, not. That might be part of it, but the majority of it is knowing the human body. We go through full cadaver dissections to learn it, know it, how it works, all the mechanics involved in it, and we're the only specialty that does that kind of thing. So it's very important for post-op patients, very important for non-surgical pain patients. And do you have anything to add?
Sure. Specifically after some surgeries such as knee replacements or a knee arthroscopy or a shoulder surgery, if you have the surgery alone, you're not going to regain your function and ability to reach and cook and do things around your house. The surgeon fixes the problem, but along with that is swelling, stiffness, and pain, which kind of sets you back. And if you don't go to physical therapy, your outcome, you're not going to be particularly pleased with your outcome because you're not going to regain your function. I know Ari's mom experienced a knee replacement, and without the therapy, you can't really recover fully.
Right, exactly. I know a lot of people here have been talking about, they've had knee replacements, and that seems to be a big thing now. A lot of people are getting knee replacements, and they're not recovering. And you would say that that's due to the lack of physical therapy?
Yeah, if you, I mean, usually after you have a knee replacement or shoulder surgery replacement or whatever, physical therapy is usually ordered. It should be. Occasionally it's not. Not really sure why, but if the patient comes in and if they are at a good physical therapy place and they follow through and they participate in all of it, your outcome will be good and you'll end up perfectly well and doing great. If you don't, like Farrah had mentioned, scar tissue grows in anytime you have any trauma, surgical or non-surgical, to your body. And if you don't address that, you're not doing the right stretches, joint range of motions, things like that, the joint's going to stiffen up. You'll end up with a knee that doesn't straighten all the way, or a knee that doesn't bend all the way, or a shoulder that doesn't lift up all the way, and then that's it for life. And then you're kind of done with that, and then that's it. Now, we've seen people have surgeries, and either the therapy's, I don't know, too painful, it didn't get ordered, or they didn't want to follow through with it, and then their quality of life is diminished because they've got a knee that doesn't have good range of motion, which then when they walk, it affects their back, and then they've got back pain, and it's just a mess, and we're looking at it going, man, all of that could have been prevented very easily in however long it takes, 6 weeks, 12 weeks, or whatever, to recover from that.
So is that the average time of recovery, 6 to 8 weeks from any particular surgery or injury?
Let you take that one.
Well, there's a variety of ranges, and the reasons are, it depends on the surgery you had, what body part it is, your general health, how bad it was prior to surgery, depends on your surgeon's skill level, your tolerance to pain, if you've got other issues with your body and health. So I would say in general, a time frame for all the procedures done and things that we see would be 4 to 12 weeks. Some could be a little shorter, some could be significantly longer, but that's just a good general range. And usually people are attending therapy 2 or 3 times a week, rarely more than that, and rarely once a week, but on occasion somebody might do that. If they want to do stuff at home or at gym, they want to come in once a week just to learn what to do and progress their own program and so forth. We try to do whatever the patient needs or wants, and no more, no less. So
That's a great, I'm glad you mentioned home. When you mention home, how important is it for people to follow through with the things that you tell them to do at home? Is it important that they do physical therapy at home?
Yes, definitely, it's important that you do it at home. Just doing things 2 or 3 times a week isn't going to be enough to make a difference in flexibility and strength. I always kind of compare it to a diet. If you just eat healthy food, 2 times a week, then you're not going to be able to lose the weight. The same applies to exercise, stretching, regaining your balance, all those things. You need to work on it daily in order to see a good difference in a good shortened amount of time.
I'd say the way we look at it as therapists, it's kind of a lifestyle choice. Most therapists that I know, they do what they do, but they also, when they do it because they believe in it and they live it, our bodies are what we have to live in. And it's like a machine, and we're the mechanics. The surgeon is a mechanic in a way that he'll fix stuff, but then that's half of it. And you get to rehab it from scar tissue and weakness and the pain, swelling, whatever. So we're the mechanics on that end. And if you don't service your machine, which is your body, whether it's a surgery that you need or even to address a painful joint that doesn't need surgery, if you don't do that, you'll run into problems. It's inevitable. Everybody, I'm sure, has aches and pains. They all start at roughly 30, 35. And if you learn what to do and you do it, they're very simple things, and you apply it, it doesn't take a lot of time. It just takes the desire to spend whatever it is, 30 minutes, an hour, 3 days a week, maybe daily, even daily, that's really not that much time, to optimize the machine that you live in to minimize any pain, maximize your function. You know, if you have pain, I'm sure you all know this, but it affects your mental status, it affects your mood. You know, it affects how you feel when you get up in the morning, when you go to bed at night, how you interact with your friends and your family. You're more grouchy if you're in pain. I am. I know that for sure. I'm more grouchy when something hurts my back or neck, or I tweak my shoulder or whatever. I'm very lucky, like Farrah is herself, and to be therapists to know how to address that right away, get it resolved and move on, so that we can mainly service our patients who come in with pain, because we got to get our bodies out of pain so that we don't deal with issues, so we can help you deal with your issues. So, you know, that's one way to look at it, that, you know, your body is something that's absolutely worth taking care of, more so than your car or your home by far, and that's what we believe in deeply, so.
Yep, you said a couple of things. First, I wanted to address what Farrah was saying about the time frame, 8 to 12 weeks, 6 to 12 weeks. And I guess I'm different because I've been there like 3 or 4 times for about 8 weeks at a time, because it doesn't work for me. I'm not doing something right.
Okay, so physical therapy is one tool to help you get better. Some people do require other things such as injections or surgery. Physical therapy isn't always, I hate to say this, 100% of the answer all the time. There are people who do require other things just besides the therapy to get better. So there is a big group of people, though, that do require that therapy alone will help them resolve their pain and get back to moving and their function again.
Okay. The other thing, VIAJAY was saying that the patient, when you're in pain, it affects your attitude and everything that you do. And I know that Green Oaks is successful partly because of the dedication of your physical therapist. And with that, I wanted to say that it is important that you have a therapist, that you have a relationship with your patients. Is that not true?
Very much. I always tell my patients, you know, we don't all like each other, unfortunately. You know, you like some people more than others, and if you don't feel that relationship with your physician or your physical therapist, you're probably going to put up a wall and not do your best to follow through and do get better. So it's important that you have a good relationship with your doctor. If you don't feel that with your doctor, it may be a good idea to get another opinion or try another doctor. And the same goes for physical therapy. You know, occasionally people get along better with other people, or they understand an explanation the way one person says it versus another. So it's important that you have a good physical therapist that cares about you and that you feel like you're benefiting from.
And also, if any of you ever are in need of physical therapy, again, post-operative, non-surgical, whatever, it doesn't matter to me where you choose to go, whatever's convenient, you know, whatever you choose is fine. You just have to be aware or cognizant that the place you go to has to not only put the individual connection with the therapist, you know, your lead therapist, but it has to be an environment that you're comfortable in. You feel a certain, you know, energy there that helps you through that, because when people come in through the door and we know they're in pain, for instance, for us, and other places do this too. I mean, obviously, I feel we do it better than anybody, but I have to believe that. It's just my opinion. But that's for the individual to decide, obviously. But, you know, when people come in the door, we recognize that they're in pain. And our job is not only to get that knee better by knowing what to do from a scientific school standpoint. That's easy. That's the easy part. But connecting with that person and connecting that person in with our clinic and getting them meshed in so that they don't even know they're participating in physical therapy. You come in there and we try to make it such a social environment that the physical therapy is almost a secondary thing that's happening during your social time, which is about an hour, hour and a half, sometimes 2 hours. That, I think, has been key. I think that's key regardless of where you go. For us, that's been a key thing, not only for our success, but for our enjoyment. You know, Farrah has been with me when we opened up the clinic from pretty much the get-go. I don't even know, 10, 11, 12 years. And I think that she enjoys that also, and that's why she's still there, otherwise I think she would have left. But, so wherever you go, make sure that that is something that you look for. You shouldn't go in somewhere and feel intimidated or worried or apprehensive. It should feel basically like a second home. Maybe not after the first visit, but you should get a good inkling. The second visit for sure. So just keep that in mind.
Absolutely. I absolutely agree. I just had to stand up for a minute because I wanted everybody to see that I knew physical therapy was today. So
All right.
And I just want to say something, and I know that we don't do any advertising, and I'm not going to pick one place over another, but I am a patient at Green Oaks Physical Therapy, and that is one of the reasons that I prefer that they be here today, because the environment. I've been in physical therapy. I've been going through this problem with my knee since 2008, and I've been to many physical therapists before. But the environment, it is a social environment, and everybody who knows me knows who I am, a social butterfly. So it works very well for me. And the treatment, the relationship, when I walk in the door, Farrah is my therapist. Farrah knows when I'm hurting. You're in pain today, come on, let's do this. So it is important that wherever you go, you have a relationship with your therapist. Now, you know what time it is? Does everybody know what time it is? It's about 10:30. What do we do at 10:30?
Don't worry, you tell us.
You already know, but my favorite part is
You haven't drawn.
That's it! What's going on here? We're gonna do some door prizes right now. One of my favorite things to do.
I have a question that I would like to ask.
Okay, we're gonna do question and answer.
Okay.
Thank you, Beverly. Let's get your tickets. Anybody didn't get a ticket?
Pretty music.
You guys, you know what? You guys can talk right now while we're doing it, and I'll just anything you want. Just talk.
Has anyone here had any surgeries that they've had to attend physical therapy for? Various knee, shoulder, back, neck, something? Good experiences, bad experiences? Good?
From what, I'm sorry?
Oh, from anything, any particular surgical procedure that you had to attend physical therapy for?
No, talk yet. Just.
Oh.
I just want to say that it hurt like crazy, but I knew that I had to do it. I broke my hip, so I did this, physical therapy twice a day, 30 minutes each session. But if I hadn't done what they told me to, I wouldn't be able to move around as easily as I can.
Yeah, hip fracture surgery, that's a big one.
Can you tell I love these people? Okay, let's come here and have this next one pull a ticket for us. Thank you. And the winner is 977.
Last three.
That's the last three, 977. 977 going once.
Oh.
Last three numbers,
Yes, ma'am.
977.
Yes, and we have a winner. Yay!
All right.
You're welcome. And do you want to pull a ticket for me? Thank That's 984. Yay! Love this. 984. Yay! And can I get you? You know what? I know we have a very serious topic today. Thank you, Annie. The number is 972.
Whoa.
Here, way back there, here. Yay! Free car?
Dang.
I'm gonna let her do that. I'm gonna actually let her do that.
Okay, the number. Okay, the last three numbers is 968. Oh my goodness!
Thank you, Annie. Thank you very much. Everybody's still a winner, okay? We don't have any losers around here. We don't know what that means. Everybody also should have gotten free Dickie passes for free Dickie sandwiches. Great. I do want to take another moment because somebody said I got a car. Who said that? Well, that's okay. What did you get though? What did you really get?
Dinner for two.
Dinner for two.
At
Dinner for
Chuy's.
Dinner for two at Chuy's. Oh. I want to thank Chuy's for that. Okay, we're gonna open up the floor for questions and answers. I know we have a lot of questions for the therapists today. I see a hand here, a hand there, and this was my very first hand. So guys, be patient with me. I will get around, okay?
I'd like to ask, does your company accept Medicare? I'm a retired military widow, and I have Medicare and TRICARE for life. But do you all accept Medicare and other supplements?
Yes.
Yes, we pretty much accept everything.
How about the tip VA?
I believe we do, yeah. There's not any insurance company that I believe we have run into that we don't accept. You know, we see a lot of VA patients. I don't know the specificities of all the different plans in the VA, but I believe we accept all of that. TRICARE, Medicare for sure. TRICARE is really good.
TRICARE for life
Yeah,
and Medicare.
they do a good job. And Medicare does too. More paperwork, but.
See, social. The next hand will go over here.
Yeah, I had a right total hip and a left total knee in 2000 and 2001, and I had the in-home therapy and all that, and everything worked out fine. When I came here a couple of years ago, I was diagnosed with spinal stenosis, and they wanted to do shots and therapy and all that, and I guess I didn't trust the people I went to because I didn't go for anything. As a result, I walked with a bent over and all that. Do you have good results with physical therapy with spinal stenosis? Because that's very painful, and can you really get over that?
So we do see a lot of spinal stenosis patients, low back and neck. And I would say that physical therapy alone should be able to help that condition to a varying degree. Some people, it depends on how long you've had it, how progressed it is. But without a doubt, you'll benefit to some degree. I don't know, 10%, 20%, 40, 50%. It varies per the patient. Again, how long you had it, how bad it is. If the physical therapy isn't as successful as you would like it, usually the doc will then, like you had mentioned, order injections. And then coupled with that, that tends to be a little more helpful. If it got to a point where it was beneficial enough, but still not enough to your liking, there are even surgical procedures that, you wouldn't, you don't want to do that unless you're, in a position where you're kind of forced. But even the procedures are getting better and better and less invasive and less invasive. I know surgery is really scary for a lot of people. It took me 3 years to talk my mom into a total knee, and she was just getting worse and worse and worse, and now she actually comes here, walks on the track and whatever. But even with me doing what I do, for as long as I've done it, she was apprehensive about doing any kind of procedures. But the surgeon selection and the type of procedures out there now are so good that, as long as you pick a good doctor and do good rehab, your outcomes will be really good and your quality of life will improve, dramatically. So physical therapy alone, though, should be helpful for stenosis. Again, it's hard to say percentage-wise because it depends on length of time you've had it and just how severe it is. But there are things you should be doing for it. It's a specific condition, where the nerves, the holes are getting more narrow, and there are certain stretches you can do to, just to make it simple, open up the holes where the nerves come out of and give the nerves more room to live in. Because they get angry when they get close in on it. So, did that answer your question?
Yes, it does, thank you.
Wow. Who else had their hand up? Christy. I remember hearing, you guys tell me about this, that even though you guys have a master's degree in physical therapy, that is now grandfathered into the doctorate program, is that correct?
Yes, that's correct. I'm not sure how many years ago that took place, maybe 3 years ago. It became a doctorate program. The overall goal for our association, the American Physical Therapy Association, is that we eventually have direct access where y'all can come straight to us without a doctor's referral. And that's one of the reasons they recently switched it to a doctorate program in hopes that we can do that someday.
That is awesome.
For now, you do have to have a physician's referral, and it can be from any physician, your primary caregiver, an orthopedic, a neurologist, any physician can send you to physical therapy. And the majority of times, if you ask them to try it and they haven't brought it up to you, they're gonna agree and write a prescription for you. Sometimes they forget about us, and it's nice for y'all to remind them.
Yeah, that's right.
Yeah,
That's right.
everything Farrah said is right and right on and great. And just for more information, because I like this topic, in the military it's done that way. If somebody gets injured, they hurt their shoulder or knee, they go to the physical therapist first and just cut to the chase. Because if you go to your medical doctor, medicine, wait a couple of weeks, medicine, wait a couple of weeks, then send you to physical therapy, you kind of lost all that time. The whole thought of it was, the military does it, they're very, obviously, if anyone knows the military, they do everything for efficiency purposes. So, you go straight there. If you need surgery, they refer you out. If you need medicine, they refer you to the doctor. So eventually it'll get that way in the civilian world. But for now, like Farrah had said, if anyone feels that they needed physical therapy, all you have to do is ask your doctor. They've got so much to think of when they're dispensing medications, and medications that counter with other medications and other systems in your body. They're not really worried about, like your physical health from your shoulder, knee, kind of back type standpoint. They're concerned about your internal organs and your system health, and are the medications that they're giving you going to counteract with another one? So they've got a lot on their mind. So it's really up to the individual to consult with and talk with and let their physician know, because the physician wants to help them, but the physician has to know, okay, what else do you need? Because I've got your systems working good and you're healthy in that sense, so move on. And then if you have another issue that you're like, oh, my shoulder hurts, can I go to physical therapy? Great, awesome, go to physical therapy, thanks for letting me know. That's what the physicians, that's what the feedback we get is, they're so busy with all this stuff, they don't have time to ask you about your shoulder pain unless you ask them.
Wow. great information. I didn't even know that. I didn't know any of that. Christy, you have a question? Excuse me.
The question is not too much about physical therapy, but I've heard you mention your environment, your social environment, and I'm wondering if it's the background music, the colors that you've chosen, or what is it that makes people so comfortable?
Good question.
Sarah, you see me running?
So the environment, in my opinion, for it to be a healing environment, first and foremost has to be the people. Regardless of the clinic, the people have to have the right mindset, and they truly have to be there because they want to help people. So in hiring, I don't hire anyone who is not cut of that cloth that they want to service and help other people. And if they don't have that in their, in their eye or in their heart when they come in, then there's just no point in going on. So we try to always hire people who just have that, I call them energy givers. We don't hire energy takers or neutral people. If you're not an energy giver, I can't have you at the clinic. So it starts with them. We're a cohesive group. We all get along, and we try to take that energy and transfer it over to the patients who come in. Coupled with just the colors on the wall. We've chosen the colors on the wall to be, kind of, I don't know, festive, I guess you could say, to kind of add to that, whole environment being lively and fun. The layout of the clinic is very open, and it's not very closed or choppy, things like that. But, so we put thought into all that stuff, pictures on the wall or whatever, but it really starts with the people. We have awesome people. I mean, they are tremendous in their just desire to help and to get to know you and to talk with you and engage you in conversation, to distract you from what you're doing that might be painful. And then I don't know if you want to add or...
I'm trying to think of the right way to put this, but our clinic, because we engage and we talk and we have fun, and not only just talk about your pain and the therapy you're doing, we try to, help, what did you do this weekend, get you engaged, that gets other people around you engaged, and you become friends with other people that go there, and that helps in the healing process. It helps to have somebody next to you going through some similar things that you're going through so that you don't feel like you're alone. And in our clinic specifically, I feel like that that air, that environment is present, and people get to know each other and want to kind of come at the same time as somebody that's going through similar problems that they are.
Absolutely.
Your aquarium is very beautiful and very soothing when you
Oh,
come in.
I've
It
seen
keeps
the
you in
aquarium.
the mood.
I thought we'd seen you before. We were just talking about that.
The aquarium is absolutely beautiful when you come into the lobby, and I love it.
It's absolutely true. And the thing about, and I think you should have this wherever you go, but I can only speak for where I'm comfortable. And at Green Oaks, all of the therapists, not just your therapist, and they all seem to know you, and they know what's going on with you, and they all work together as a team. And I see you, and I have Pat right here, and then you're next. You wanted to talk about yours. You were saying something before we were doing the door process. Go ahead, ask your question.
I can't remember what.
You can't remember? That's okay. Senior moment. Senior moment. How many times do I have them in the show? About 5 times. Look at this, I'm running. I might get physical therapy tomorrow.
I heard you mention therapy about internal organs. What I'd like to know, do you only deal with the joints, aching joints, bones, or do you have therapists that will help an internal organ? For instance, the uterus, if you don't want to have a hysterectomy, and I understand that some people give therapy for, I don't know if you do, for like a prolapsed uterus. And you don't want to, the doctor says, do a hysterectomy, but you don't want a surgery. So if you sometimes work with the, help with the any internal organs.
That's a good question. That's a very good question. Are there alternatives to surgery for some of the internal organs?
So we only focus on musculoskeletal injuries, joints, muscle, bone, nerve type stuff. But there are specialties that do that, and I think Farrah knows more about that.
I know a little bit. There are some clinics that have therapists that have studied more about those kind of things, specifically the female organs. And we have a patient actually right now, she's coming to us for more musculoskeletal problems, and she's going to another physical therapist that specializes more in that. But there's not a lot that we do aside from the musculoskeletal. We do a little bit for inner ear problems, dizziness problems, but mostly musculoskeletal.
I want to make sure I understood that correctly. There is you can specialize in physical therapy for certain things like that. Was that correct? Did I get that right?
Yes, for you, people who have a certain interest in different topics can go to more continuing education courses, towards those things and become more specialized in them, yes.
Wow. Great, I didn't know that either. Somebody learned a lot in this show, right? You talking for yourself, come on now.
Well, my question is, you mentioned about people that had surgery, something like knee surgery, for example, and they did not do the physical therapy like they should have, and now it's stiff and they can't use it. Is there any correctiveness for that, whether they have to go back to surgery to maybe remove some of the scar tissue or whatever, and then do the physical therapy correctly to get their motion back?
So if somebody had a knee surgery or shoulder surgery, like you said, they didn't do physical therapy or they stopped early and they ended up with a stiff joint, knee or shoulder, and then they were to come in, I think the best thing to do would be to try physical therapy first alone, see how much progress you can get just with the physical therapy non-surgical route. It's quite possible to regain full range of motion still. It all depends on what's tight. Is it just muscle, tendon type stuff that's tight, the joint capsule, or is it some really hard scar tissue that's built up in there that's going to be a lot harder to stretch? And you really don't know the answer to that until you apply some, therapy or stretches or we stretch here or whatever, and you can kind of tell by how it progresses, looking then back in hindsight, what might have been tight. So you try the conservative route, you can make some great progress, maybe resolve the whole issue and move on. And if not, and if the joint near your shoulder is bad enough where it's impairing your life, then yeah, you could then go to the surgeon and then they could do a small scar tissue removal procedure, send you back to therapy, get that right. It's kind of like opening the door back up again, and then off you go. But you definitely should not live with that because it impairs the quality of your life. And that's something that when I see people with problems like that, I just look at them and think, man, that could be better for you. You don't have to deal with that. There are things that can be done to where you can enjoy your life more. They just didn't know. So yeah, to answer your question. Good.
I hear so much passion when VJ talks about the body and the skeletal system, and it sounds to me like, and I just want to know, it takes a special kind of person to do this, is that correct? And you have to really love what you're doing in order to help people, is that right?
I'll come back to you in a second, I'm sorry. You absolutely have to like it. You have to love it. If you don't, I cannot imagine, because, and I say this it's absolutely truthful, but also kind of to be funny. Now, if you think about it, people are coming in and they're in pain all day long. Just people coming in, they're in pain, they're in pain, they're in pain. And if you don't love helping that will wear you out quicker than anything I can think of. But if you truly, truly enjoy it, it's like you have this, tank full of energy to give, and you just give it, and at the end of the day, you feel like you've done something productive and good with your life. You go to bed, you recharge, you do it again. I have run into therapists in my course of my career that went into it not knowing what to expect. They came out and they didn't really enjoy working with people, touching people, being next to them, listening to their, issues or problems or the pain. And it was a beating for them to be in that field. And I felt bad, like, oh man, you are not enjoying this. I can just tell this is just not what you want to do. And then they'll kind of find a different route. Maybe they'll go into an administrative function or whatever. But you do have to have a certain, passion for it, I guess. And with that being said, Farrah's got to say something about it because she's got that. I definitely feel I do, but when we hired Farrah and I saw Farrah starting to work with her patients, she would get so, she's a lot better at it now, but she would get so into her patient's condition that it would affect her personality. She would, just be upset if something wasn't going right with somebody and there was nothing she could do about it, or she was exhausting every single avenue that she knew how, and she would not let it go. She still doesn't let it go, which is good, because she's all in, because she's just drawn to that. So you just...
Again, that's why it's so important that you pick a physical therapy clinic and a physical therapist that you feel like is giving that to you, because there are good and bad physical therapists. Again, we have the knowledge, we went to school, it's not that they don't have the knowledge, but if you don't put the personal skill with it and that passion with it, you're not gonna have, good physical therapy.
Here.
And it makes me very upset because I've run across them and I just don't understand how you couldn't have that passion, because I do. And yeah, it makes me mad to see somebody that doesn't, or that's had poor physical therapy and comes to me later with a very stiff knee when I know that something could have been done earlier.
True, I know that to be true. You're next, she's first, and I know that to be true for a fact because, like I said again, Farrah is my therapist. Here we go.
I have a friend that had knee surgery, hip surgery, and he goes to physical therapy twice a week. But when he comes home, he doesn't do anything to, help himself to get better when he goes back the next week. Do you have any encouraging words that I can pass on to him?
Great question. That's the best question I've heard all day, because I didn't do it either.
It's difficult to force somebody to do something. It is. They have to want it for themselves. They have to want to get better. So it is hard to make somebody else do it. All you can do is continue to provide encouraging words to educate them about the need to do it at home and follow through, or they're not going to get better fully. But yeah, you can't force somebody to do something that they don't want to do, but if you continue to encourage them, you know that you've done everything you can.
Well, his daughter and I both encourage him, give him encouragement and tell him that if you don't use it, you will lose it.
And that is true, yes.
I can say, Vijay, I'm gonna give you the mic next because I want Vijay to comment on that as well. I didn't do my physical therapy at home. Before I went to Green Oaks, I'd been to several different places, like I said before. And so when I got home, I didn't want to do my physical therapy. And one thing, they don't make you do stuff when it hurts. They guide you and coach you through it so that you can get to a point where you can do it. And Farrah did tell me those words you were talking about, encouraging words. If you don't do it, if you don't use it, you'll lose it. And that you want to feel better, you're going to have to follow through. Do you do this at home? Have you done this at home? Well, she probably doesn't even remember having to do that, because after a couple of times, I started doing it myself because I knew that I needed to. And when I came back to an environment that was conducive to me growing and doing that, it was easy for me to do.
I think the only thing I can add to that is, from our standpoint as a physical therapist in that person's life and their recovery, is, we're always looking for ways to tap into that person and connect with them and to find out what we need to do or what we can do to help motivate them to participate with their home program. It's different for everybody. Every person coming in is a whole new challenge, and that's how we look at it. You know, what can we do or what do we need to do to connect? It's kind of a game even. Sometimes people come in, they've got such a wall up about doing any of it. They don't want to connect. They don't want any part of this. And we kind of look at it as, in about a week, I'm going to have that person bringing cookies up here and just watch. So that's kind of like it's kind of like a little game for us, in that we try to figure out what we can do to connect with this person to get them more involved. If it's just getting them to focus on, you know, maybe they feel like it's a big burden. They go to physical therapy and it's just, you know, hard for them and they don't want to do it at home. Well, okay, well then let's just pick one thing for you to do at home. Just one thing, make it easy, make it fun, as simple as possible, simple instructions. Just please do just one thing and then we'll be good with that. And if you give them 5 or 6 things, which a lot of younger physical therapists and, you know, whatever, they just overload the home program and then the patient feels like, I can't do all of that when I go home, and then they just shut down. So, you know, 1 or 2 things maybe in the beginning, that's one quick strategy that I use.
I tell a lot of my patients to put it like in their plan of the day. So you know that every day before or after you eat breakfast and before you watch, you know, your morning show, whatever you watch, that you're gonna do the exercises at that time, or while you're watching a certain television show, that you do the exercises at that time so that it's part of their routine and they remember to do it. And same thing, I try to minimize the exercises. Sometimes it can be something as simple as, okay, if you're gonna go get up to go get something from the kitchen, instead of just going straight to the kitchen, if they need to work on their endurance and their, you know, walking and gait, that they have to, you know, do a lap or 2 through the house before they make it to the kitchen so that you can integrate things into their routine so it doesn't feel so much like exercise as just an extension of what they're doing in their day.
It's very funny, I had an injury in my neck, and Farrah does massage too. And she told me that when I'm at the traffic light, to do like, and it was kind of funny just watching her do this. But I did it. It made it easier for me to do the exercises when I was not there. Do we have any other questions, comments? Mary?
Hi, my name is Marie, and I just want to tell you, it is true what you say about going to physical therapy, but I had a bad experience on my shoulder surgery, and I just went like 6 weeks, and I said no more, because my physical therapist would hurt me very much. So I told my doctor, I said, is there any other physical therapy I can do? And he said, yes. Are you willing to do it at home? I said, yes, sir. So I did it at home. And all my friends used to say, you're doing physical therapy on your shoulder and you're not going to be able to move your arm up, back, and hold it straight. And you know what? I did my physical therapy by myself at home 3 times a day, every day. And I can move my shoulder any way I want. And then I went to my back surgery, and I told my doctor, I don't want to be going to no physical therapy center. He said, I'm going to send you physical therapy at home. So I did it at home until I got well, and I could walk, leave my walker. And my neck, my last surgery was my neck. And I had physical therapy all the way at home. And I'm doing real good on all 3 things. I thank God for it.
All of the surgery that you had at home, you did by yourself. Is that correct?
Physical therapy.
Yes, that's what I meant to say. What I said? I said
Surgery.
I can't even call it a singing moment.
I had special physical therapy persons up to 3 persons and 3 more, like balancing and all that stuff that I needed at home.
The therapist came to your house, is that what you're saying?
Yes, the therapist came to her home is what, excuse me, Deborah, is what she's saying. And the reason I asked her that question, just in case anybody was wondering, is because we can do there are a lot of things we can do at home, but we're gonna need guidance in order to do it. We can't just say, okay, I'm gonna do physical therapy without having a physical therapist to actually show us the things that we need to do, even in continuing therapy. Because even though right now I'm not in physical therapy, one of the first things Farrah said to me when she entered the building today was, how's your back? And I said, it hurts, I'll be back. But, but you know, what I'm saying is that even when we're not in therapy, the things that she's already taught me, I can then put into my life every day to help me maintain that. Are there any more questions? Oh, here.
Everybody's so different that, like Ari said, to get the guidance to know what to do, that's the important thing. There's home therapy, there's clinic therapy, there's hospital-based physical therapy. It really is the environment that's suitable for that individual that is most important. The stuff that I do for myself, or whatever aches and pains that I deal with from injuries, I do it at home. But when I'm in the clinic, I'm at work and paperwork and whatever, and then when I go home, because I know what to do, I do it at home in my bedroom. So, and that's very effective, because it doesn't matter where you do it, it's just that you do it and you know what to do. Sometimes, the equipment's obviously very nice, because you can advance, more rapidly to a higher level and so forth, but it's not absolutely necessary. It just makes it easier. So really just, the environment that is most appropriate for the individual and getting the right guidance, I totally agree with you that is what makes it work, for that individual.
We are running short of time, and of course you know that I am very mindful and respectful of your time. But I want to plug in the summit for a moment, okay? So I want to ask Farrah and VIAJAY, what did they think of the summit? I took them on a tour before a show today, and I just wanted them to share with you what they thought about it.